What is vitamin A?
Vitamin A is a fat-soluble vitamin, which includes retinol, retinal and beta-carotene. Vitamin A has several vital functions such as cell differentiation, which is important for growth and development, antioxidant properties, for the maintenance of the immune system, and for night and color vision ability. In foods of animal origin, the major form of vitamin A is retinol palmitate, which is converted to retinol in the small intestine. The retinol functions as a storage form of the vitamin and can be converted to and from its visually active form, retinal. Vitamin A is needed by the retina of the eye in the form of retinal to form rhodopsin, which is necessary for both low light vision and color vision. Vitamin A also functions as retinoic acid, an oxidized form of retinol, which is an important hormone-like growth factor for epithelial and other cells. Vitamin A can be found in two principal forms in foods. Retinol, a yellow fat-soluble substance, is the form of vitamin A absorbed when eating animal food sources. Carotenes, such as beta-carotene, a provitamin A, is the form of vitamin A obtained when eating plant-based food. Vitamin A deficiency is estimated to affect approximately 1/3 of children under the age of 5 around the world, and it is also the leading cause of preventable childhood blindness. Vitamin A deficiency can occur as either a primary or a secondary deficiency. A primary vitamin A deficiency occurs among those who do not consume an adequate intake of vitamin A. Early weaning from breast milk can also increase the risk of primary vitamin A deficiency. Secondary vitamin A deficiency is normally associated with chronic malabsorption of lipids. Since vitamin A is a fat-soluble vitamin, it is very dependent on the proper fat metabolism and absorption in the small intestine. Zinc deficiency can also impair absorption, transport, and metabolism of vitamin A. In malnourished populations, common low intakes of vitamin A and zinc increase the severity of vitamin A deficiency and lead to physiological signs and symptoms of the deficiency. One of the earliest and specific manifestations of vitamin A deficiency is impaired vision, particularly in reduced light, which can cause night blindness. Persistent deficiency will lead to total blindness, impaired immunity, and tooth problems. Some of the problems caused by vitamin A deficiency are as follows: xerophthalmia, in which the eye fails to produce tears; xerosis, an abnormally dry skin; Beteau's spots, a buildup of keratin in the conjunctiva of humans' eyes; keratomalacia, where cornea gets cloudy and softens; ear infections, urinary tract infections; meningococcal disease; hyperkeratosis, a thickening of the outer layer of the skin; keratosis pilaris, benign skin condition of a buildup of keratin in the pores; enamel hypoplasia, a defect of the teeth in which the enamel is deficient in quantity. Adequate supply is especially important for pregnant and breastfeeding women for normal fetal development. However, excess vitamin A can cause birth defects. Given that vitamin A is fat-soluble, disposing of any excess taken in through diet takes much longer than with water-soluble vitamins. This allows for toxic levels of vitamin A to accumulate. These toxicities only occur with preformed vitamin A, which taken through animal-based food. The carotenoid forms give no such symptoms, but excessive dietary intake of beta-carotene can lead to keratinodermia, a harmless, orange-yellow discoloration of the skin. Excessive vitamin A consumption can lead to nausea, irritability, anorexia, vomiting, blurry vision, headaches, drowsiness, muscle and abdominal pain and weakness. In chronic cases, drying of the mucous membranes, hair loss, dry skin, fever, insomnia, fatigue, weight loss, bone fractures, anemia, and diarrhea can all be evident, on top of the symptoms mentioned. The amount of vitamin A you need depends on your age and sex. Average daily recommended amounts are as follows in micrograms. Children requires about 300 to 600 micrograms. Women requires about 700 micrograms. Men requires about 900 micrograms. Pregnant women requires about 770 micrograms and breastfeeding women requires about 1,300 micrograms. If you plan to take supplements, please ensure the supplement sourced its vitamin A from animal-based food. Plant-based provitamin needed conversion, but in humans, this conversion is quite inefficient. In comparison, while 80% or more of natural vitamin A from animal sources is absorbed, only 4% or less of carotenoids from plant-based foods are absorbed. Vitamin A can be found in many foods, so it's generally easy to get your daily requirement of this vitamin from your diet. These are some of the best sources of dietary vitamin A available: liver and organ meats, dairy products, sweet potato, green leafy vegetables, carrots, squash, peppers, and cantaloupe.